Hello, this is Dr. Masoud from Soft Touch Chiropractic. We are in Portland, California. Today's guest is Dr. Jerrold Sugarman. He's been in practice for over 30 years, and it's safe to say he's one of the authority in his industry, which is dentistry. He's one of my dear friends. I trust him with my teeth and my life. He's expert in removing amalgam, a silver filling. And without any further delay, Dr. Sugarman, welcome to our show. And what are the consequences of, and what is the negative consequences of having silver filling?
Thank you so much for this opportunity to share. The question being, what is the negative effects of silver mercury fillings that are in our mouth, especially if they're old. One has to consider what's happening with fillings nowadays. There is a movement, and I believe a very good movement, away from silver mercury fillings. Not that I would want anyone to panic about this, because many people, I believe there was something like 200 million people in the United States have silver mercury fillings in their mouth. Oh my God. I wouldn't want them to be panicking, but I would love for every single one of them, as those silver fillings get old and start leaking and allowing germs to get underneath them, that they would replace them with the new materials that are out. New materials are so wonderful, so beautiful, so sensitive to the oral environment, that I think it's a great advance that we're making. Silver mercury fillings have been around 150 years, and they served a purpose. Okay. And the ADA touts them even still today, because they believe that the compounds are safe. They believe that because they believe that the appetite, the combination, the alloy, has very little free mercury in it. A minuscule amount. However, even a minuscule amount is something that I would rather avoid. I have to take these silver mercury fillings once I remove them, and I have to put them in a hazard bag and have them transported out of the office. I cannot flush them down the drain, or Wow. So there's a statement there that says that maybe we shouldn't have them in our mouths. Yes. And so with the new materials that are coming out, they look better, they feel better, they don't have that one issue of mercury, which is a very toxic material by itself. It's good to avoid it if you can, and with the new materials that are out, I think it would be crazy to have anything like a silver filling used today. I have not done silver fillings in more than a decade.
Let me ask you, how old the silver filling should be in order to consider we need to replace it, or if somebody has it less than a decade, they should wait, or if anybody has a silver filling, it's better to replace it immediately. What are the criteria? As you said, 200 million people, they have them in their mouth. What would you say to one patient that is very important to change it immediately?
The average lifespan of a silver filling in the United States is 7 years. Way before that time, they do have signs of expansion and contraction, and the margins tend to crack. I would say if they have any of those signs, which is pretty soon after the original placement, not immediate, but it's there. It's there. I can see it probably in 3 to 4 years after it's originally placed. Mm-hmm. That I wouldn't want it in there. I wouldn't want it in there, not just because of the mercury, but because you're dealing with a metal, an alloy, that expands and contracts differently than the enamel. So if you drink a hot cup of coffee, which is near boiling, that silver is expanding greater than the enamel. And if you drink something as cold as a frozen drink, almost near freezing, then it contracts. So you're having kind of what would be to a microorganism a freeway created for it to get down inside. Invariably, there hasn't been a silver filling that I removed that didn't have some sort of decay around the edges of it. Most of the times underneath it, deeply underneath it. I never felt guilty about removing them. I usually look at them. I'm very conservative because I don't like to do too frequent of a preparation on a tooth. I don't want to do that often. I like to spread it out a little bit. Most silver fillings that I look at don't look very good, and so I don't feel guilty at all in saying almost all of them need to be removed.
So basically, what I understand, you're saying if you have a silver filling, you better replace it.
I would say be open to that.
Okay, let's go to another subject. When I was in chiropractic school, we talk about that there are a lot of heart diseases like endocarditis that comes from not having gum disease or poor hygiene in the teeth that actually can give you a type of heart problem or different type of heart infection. Or can you clarify that?
There are certain conditions that people have that predispose them to a greater chance of getting endocarditis, which is an inflammation of the heart. Valve problems. If you had scarlet fever, sometimes it scars the valves in your heart. Mm-hmm. Now, by itself, that's not the end of the world by any means. People survive after having scarlet fever, or rheumatic fever, things like that. If you do have what they call mitral valve prolapse, which is a defective valve, this is a very, very, how can I say, easy site for bacteria to land on and colonate on, and you can get very sick. That's what endocarditis does do. It gets you sick, and you end up in the hospital battling a heart infection. Because the scar tissue that's on the valves is just an excellent landing site. So, if you have a gum disease with lots of germs, you have a hygienist or a doctor trying to get those germs out of your mouth, many of those bacteria get flowing in the bloodstream, and they will go throughout your whole body. Now, normally that's not a bad thing because our bodies have a great immune system that kills germs, but if there's a good place for them to land, like a scarred heart valve, they're there. And so sometimes we have to pre-medicate with antibiotics when you have a history of mitral valve prolapse, or if you have some sort of artificial joint. Those are all places that the germs love to colonate once they get inside your blood system. We want you to be protected.
Doctor, one of the common cosmetic fashion is now using this whitening product on over-counter. And a lot of them, they have, I think, when you read on the product, they have a lot of things that you cannot even pronounce. What is your take on teeth whitening and the material that is being used in over-counter, and what are the safe way to do it?
Most of the whitening agents are relatives of peroxide, hydrogen peroxide, which basically will get into the pores of the enamel and leach out the material that's in the pores. When we eat food, when we don't brush our teeth, we get microorganisms in surface features of our teeth. Mm-hmm. What a whitening agent is really doing is scouring the enamel. Mechanically, there isn't any damage done. However, in those pores, we also have little nerve endings. Mm-hmm. And you can create a real sensitive situation on some people that, the whitening agent can get down fairly far in the pores and irritate that nerve, and you have sensitive teeth. As far as dissolving the enamel, you're not going to do that. The enamel is the hardest substance in the body. Mm-hmm. Okay, it's harder than bone. It's related to bone. It's related to nails and hair. It's keratinized, but it's very strong, and so I don't worry mechanically about it. Mm-hmm. But I wouldn't want someone to have hydrogen peroxide in their mouth all the time. It actually is not something to be swallowed. Okay, I would encourage, if you're going to whiten your teeth, have it monitored. You do over the counter. It's very light concentration. The items that they use in dental offices are far stronger, but they're only meant to be used for a very short period of time, anywhere from 45 minutes. To some products, they'll let you soak for 20 minutes a day for 2 weeks, those type of compounds. But if you do those things, please monitor them because you don't want to be overdoing it. There's no need to overdo it.
All right, let's go to the next subject. When you using all this Listerine or all this product that you start gargling in your mouth, what are your take on those? Are they healthy for us in general to use them? How are they going to help our gums or gum diseases? What's your intake on that?
Mouth rinses are for feeling good. They have surfactants or soap-like products in them. Listerine in particular has an alcohol in it, which I don't particularly want my patients to have in their mouth.
Okay.
Yes, it's for the most part just to feel good. If you have an issue with, let's say, cavities at the gum lines, and people that are on chemotherapy, people battling cancer, have prominent issues with that, then using a mouth rinse that has some sort of anti-cavity agent in it, like a fluoride, which I know there's some debate about fluoride. A lot of people don't like it, and so I understand that. But when you're having cancer, you kind of have to weigh which is the worst of the problems. And so if you need to kind of kill the germs, I would rather do it with a fluoride compound or things like that aren't as caustic to the soft tissue of your mouth. Alcohol does do that to your soft tissue.
Last but not least, I see controversy. Some people say you need to floss 3 times a day. Some people say 1 is enough. Some people say flossing is overrated. Your opinion, what is your opinion on that?
All in the hands of the artist. If you're good at it, you only need to do it once a day. The thinking behind flossing is not any different from brushing. You're moving germs about. All of us have 6 trillion bacteria in our mouth. Most of them are actually needed. But there's a few that can cause trouble, a few that can cause cavities and gum disease. But what you're doing with a brush and what you're doing with the floss is that you're putting friction on every single surface of every tooth in your mouth. The enamel is a great substrate for germs to make cement and stick to it. Once they're on your teeth, once they're colonized, they produce an acid as a waste product. They eat the foods we eat. They love the carbs. They'll eat other things as well. But they make a waste product that's so acidic that it causes gum disease and cavities as well. When you put a string in between your teeth and you rub it up and down the sides of the tooth, and you put bristles of a brush on the face and the top and the sides of the tooth, you're moving those germs about just mechanically. And they have to start over making cement. It interrupts their glue-making cycle. And so that's what we're doing when we brush and floss. We're interrupting their glue-making cycle, and it buys us 24 hours before they get online again and get stuck to your teeth. If you do that faithfully and you do a good job and you don't have a single square inch anywhere in your mouth that's not touched or put a little rubbing action on there, then you won't have the germs submitted to you.
One last question, it would be the food. You just touched it. Of course, we all know sugar and sugar product, things are sweet. But let's be proactive. What are the food you recommend is actually good to chew on for the health of the teeth?
Well, you can't go wrong with vegetables. You can eat as much of those as you want. They have a classic pyramid as far as dietitians. But honestly, the average American eats 150 pounds of sugar a year. Most of it processed in their diet. Raw and natural is really a good thing. There's something about it that is I think, designed by the Creator to work well. If you want to chew on a stick of vegetable, a carrot or whatever, you're doing a lot better than eating some of the junk food that we have hanging around our society.
Thank you very much, Dr. Sugarman. And until next time, have a great day. To our listener, this is Dr. Masoud Shamaizadeh, and have a great and healthy day. Bye-bye.